Now, the California Senate just voted on Thursday to approve a statewide single-payer healthcare system. So the Senate has voted. It has passed, mostly along party lines, with a vote of 23-14. So look, this is a first step. Okay, it's a first step. It's gotten through the Senate, but it turns out on this bill, it's not complete. There's a lot of work to do. So let me explain that. Now, this comes from Senator Bell Gardens, who was the bill's co-sponsor, saying that SB 652, that is the California single-payer bill, will establish a state-based universal care system and provide comprehensive care coverage to every single Californian. Now, he also said, the bill I know is a work in progress, and I know there's a lot more work to do. So what does he mean by a lot more work to do? Well, it turns out they don't quite know how to fund it yet. So that's an issue. That's something that needs to be ironed out. Okay, well, what kind of work do they have to do? Well, again, they have a lack of funding mechanism. They need about $400 billion for this bill. Now, the Republicans, of course, seeing this, well, they jumped all over it. They said, this legislature, this is Senator John Morlock. Oh, that sounds like like an orc or something. Here comes the Morlock, coming to take your single payer away. I'm in a mood. He says, this legislature believes it can fund a $400 billion bureaucracy. It seems glib to me that it's a work in progress. I don't know how we complain about Washington, D.C. making changes to healthcare and saying they're vague when we're vague. I see this as being on the wrong road, heading right for a fiscal cliff. Fiscal cliff. That's funny. That's funny. Yeah, that's real funny, Morlock. All right. Now here's the thing, right? Turns out when you want to cover everybody with healthcare, it's going to cost some money. Yes, this is not a cheap thing. This is not a free thing. It's not free healthcare. This is taxpayer-funded healthcare for everybody, universal healthcare. Now, Republicans are like, they're not even going to pay for it. No, you do pay for it. You're paying for it through your taxes, and yes, some of those taxes will come from the rich. Now, as far as paying for this piece of legislation, there's a couple of ideas floating around. Now, the Senate Appropriations Committee staff said that the funding could come from a 15% hike in the state payroll tax, essentially doubling it from what it was now. So, look, that's payroll tax, right? So that's what you get from your paycheck. That's 15%. Ooh, that might not be very popular, okay? That's probably going to get a lot of pushback from a lot of taxpayers. Now, even though that there will actually be savings to offset from no longer having to pay for healthcare deductibles and premiums and copays and things like that. Okay, stuff that having a single payer system actually eliminates. Now, the bills, there's another idea, and this one's, I think, a better idea, more progressive idea. The bill sponsors and the largest institutional supporter, the California Nurses Association, released an analysis on Wednesday that said that single payer would actually cut coverage costs by $60 billion from the current system and could be paid for by raising two taxes by 2.3% each. Two different taxes, 2.3%. So that's much better than the 15% payroll tax, which mostly comes from people who get a paycheck for a living, the middle class. Now, the gross recipients tax paid by businesses after their first $2 million in income, that would have an additional 2.3% tax added onto that. Anywhere over $2 million in income. So again, that primarily affects business owners. Now, you would also have a similar size increase in the sales tax. Now, a lot of people might be like, whoa, you're hitting the sales tax. That is regressive. We can't do that. That's going to hurt people when it comes to food and housing and utilities. Well, don't worry. There's an exception built into this with an exemption for those necessities for food, housing, utilities, and other services. So it wouldn't actually be a sales tax on things that you need, just a sales tax on things like luxury goods, like another television or something like that. A 2.3%. Interesting. Now, this analysis said that those combined revenue streams would raise an estimated $400 billion annually to pay for universal coverage under a single-payer healthcare system. Now, You might be like, wow, that raises a lot of money from those two taxes. Well, that's still a lot of money, though. I mean, God, well, how much do we pay now? Well, Californians right now spend about $370 billion annually in the insurance-dominated system. Now, that system leaves 40% of the state's population underinsured or completely uninsured. So, look, they already pay almost $400 billion. You get rid of the state insurance plan, or not the state insurance plan, sorry, the private insurance plans. Get rid of them all. And then institute this single-payer healthcare system paid for by the extra 2.3% tax on sales tax for non-necessary things, and on business tax raising or making over $2 million. Then you can immediately pay for this. Now, according to Robert Pollin led the study for the CA Nurses Association. He says that most businesses, while there is that tax, and businesses might be like, oh shit, dude, that is an extra 2.3% tax on me? But we already offer health insurance, and that's going to cost us more money on top of that? No. Most businesses will actually save money into this because they'll no longer be paying for their health care. That's what they mean by universal health care. Businesses will be freed from having to offer health care to their workers. That's actually a good thing. Now, they said that even with the proposed gross receipts tax exempting the first $2 million, typical California businesses employing 10 to 19 people would see costs fall by 13.8%. So you know, look, conservatives will talk about, man, you're gonna kill these small businesses with these taxes. Well, it turns out the smaller your business is, the more you actually save under this plan. Very interesting. Now, the businesses employing 20 to 99 people would see costs fall by 6.8%. Businesses employing up to 500 people would see costs fall by 5.7%, and the 500 plus businesses would see costs fall by just 0.6%. But overall, did you see a price increase in there at all? I didn't see a price increase. It turns out all these businesses in California will actually save money under this universal health care plan because, again, they don't have to pay for their employers, their employees, health insurance costs. Well, that is a win-win. Everybody gets health insurance and the businesses save money overall. So it sounds pretty good. Now, right now, the California Senate hasn't figured out quite what to do, which direction it wants to go. Now, most Democrats, they voted for this, and they agreed that while the bill is incomplete as it is, that this issue, the issue of universal health care, was actually too important to stop. And look, I agree. Now, the nation, I believe, is heading towards a single-payer healthcare system. If California works out and they figure out how to pay for it, and they use the best way to pay for it, which I believe is option B, and not just raising payroll taxes, well, if they do this, then this could actually be a model for the nation. Now, one of the Democrats that voted for this is Senator Bob Hertzberg. Now, he said, quote, "Of the current bill, I see a zillion holes in it, but I'm going to vote for it today because I think at the end of the day, this question is worth debating. At the end of the day, we are a legislative branch of government, and our job is to deliberate. Our job is to ask hard questions. Our job is to take a look at what is coming at us and try to figure it out. And the message to those people who say we're irresponsible, mainly those of the Republicans, of course, I tell you, do not judge us based upon a vote in the day. Judge us upon our work at the end of the day." And so, again, the Republicans encountering this, they have your standard Republican health insurance industry talking points. Let me give you an example. "This bill is written will force people out of their current healthcare system and embrace a purely governmental run system." Oh my God, socialism, that's so scary. No, it turns out that over 54% of Democrats, according to an April Politico Morning Consult poll, support a government-run single-payer system. And overall, around 60% of Americans support a single-payer healthcare system. You actually have a lot of independents that are also in favor of single-payer, And obviously, you still have a minority of Republicans, but it's a sizable minority of Republicans that are actually in favor of Medicare for all. So, Stone continues. For those, this is Jeff Stone. He says, for those constituents that have Kaiser, if this law gets passed, Kaiser said at the committee hearing that they will close their doors here in California. Aetna will leave. Health Net will leave. Blue Cross, Blue Shield, nonprofit hospitals. So much for freedom of choice. Oh, boo-hoo. Oh, the health insurance companies. They're just going to take their ball and they're going to go home. Well, you know what? That's the whole point. We're not, if you vote for single payer, you're telling the health insurance companies to get the hell out of here. We don't need you. We don't need your high prices. We're going to do our own health insurance through the government, and we're going to pay, instead of a multi-payer system, which is what we have now, paying through third-party health insurance companies is essentially a middleman that just skims money off the top. No, we're just going to pay the hospitals directly through the government. That makes it more efficient, less bureaucracy, more efficient care. So, yeah, who cares if those health insurance companies are gone? What kind of choice is that anyway? No, you're going to get better health care, and it's going to be cheaper because it's less bureaucracy. Boo-hoo, man. You know, who's crying for the insurance companies anyway? Oh, right. It's the politicians that get the bribes from the health insurance companies. Those are the only people that are crying about Aetna leaving. For everybody else, they don't give a fuck. Get out of here. Get out of here, health insurance companies. We don't need your bullshit. We don't need your extra surcharges for advertising fees and CEO paydays. Not interested in that anymore. All we want is the health care that we pay for. That's it. All we want is the health care that we paid for. And right now, the United States, we pay more than any other industrialized modern country in the OECD for our health care. And that's because we have a for-profit model. So, look, the Democrats, they're still stressing. Work in progress, work in progress. Because, hey, look, I'm going to borrow a phrase from Donald Trump. It turns out healthcare is actually kind of complicated. So it means you want to do this right the first time. And we've never tried single payer here in America. And if it's going to be in a model for the rest of the country, you want to make sure that it launches smoothly, as smooth as possible. You remember the Obamacare rollout. It was a disaster. So you want to make sure that you launch this and that it launches smoothly and that it does what it's supposed to do. So, as its supporters have said, this is according to Senator Stephen Glazer, as its supporters said, it's a work in progress. And for me, rather than rushing to pass it before it's complete, we should keep it here and finish the work. The voters will ultimately have to have a final say on this plan, or on any plan of this scope, because it conflicts with existing provisions in the state's constitution. My view is that we should finish the policy work, pair it with real sustainable funding sources, and then we should be able to put it on the ballot in 2018. Now, whatever way that they choose to go, if they get it all right, if they get the funding right, this could be a big game changer. This could be the first domino to fall to get us to a national single-payer healthcare system. And that's what makes this a big, big deal. Look at what happened with marijuana. As went Colorado, so went Washington, so went California, and a lot of the other states that are legalizing medicinal marijuana as well. It's going to be the same thing with single-payer. We just have to get past the one first spot, the one first sticking point, the one first state. And right now, that state appears to be California. Hey everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent progressive media, please consider becoming a patron at patreon.com/TYTNation.